Our experts recommend that the second dose of the vaccine be given between 42 and 90 days. In our context, this is the best strategy because we have to deal with very few vaccines.
We're following the guidance of manufacturers and NACI in providing that second dose of the vaccine at 28 days.
The principle of increasing a dosing interval, I think, is not as problematic as decreasing the dosing interval based on the science and what we know about vaccines in general.
The dosing delay debate, all because there's a shortage of vaccines. So how do you vaccine the most people as quickly as possible without making the double dose vaccines of Pfizer and Moderna less effective? Look, provinces are clearly, as you just saw there, charting their own course when it comes to the vaccine rollout. So you got Quebec choosing the route of delaying the second dose of the COVID vaccine to get people at least partially immunized up to 90 days. Others like Manitoba are saying, no, stick with how they actually experimented with it in the clinical trials. 2 doses, 21 days apart for Pfizer, 28 days apart for Moderna. And other provinces are somewhere in the middle. The debate has been elevated to the level of the National Advisory Committee on Immunization and Canada's COVID-19 Vaccine Task Force, both falling on either side. So the question at hand, more shots and more arms but less immunity, or less shots and less arms but more immunity? Let's try to clear it up for you, because if I'm probably as confused as you. Dr. Caroline Quach is the chair of the National Advisory Committee on Immunization, and they're in charge of all this stuff. Dr. Quach, first of all, great to have you here, and we all thank you for your tireless work on this, because this is all anyone's thinking about is the vaccine. From your new report from your group, says provinces can accelerate the number of people being vaccinated by delaying the second dose. But what's the safe zone? Delay by how much?
So that's the question at hand here. So what we did was to look at the data. I think I'll explain to you how we came to our conclusion, right? So we looked at the phase 3 trials from both Moderna and Pfizer, in which after 1 dose, there was already 90% efficacy starting 2 weeks after the first dose. That's good. We don't know, of course, how long that lasts. However, in those 2 trials, participants were getting their second dose of vaccine anywhere between 21 or 28 days, depending on the product, and up to 42 days. So already in those 2 trials, you have, those efficacy data are generated on people who got the vaccine between 21 and 42 days. Now, that being said, we also looked at equity, ethics, feasibility, and acceptability. And what we're saying is that, depending on what's happening in your province in terms of epidemiology, if you're in the midst of very high rates of transmission like Ontario and Quebec, you might benefit from giving more doses to more, 1 dose to more people at first, because it would seem unethical to keep half of your doses in your freezer for that second dose in 21 days. We said, just use them all up, and as supplies come in, use that second dose to those incoming doses to give that second dose. We also know, based on immunology principles, that if in an adult person you need 2 doses of a vaccine, usually the second dose is there really to build your longer term immunity, but the first dose already gives you a pretty decent protection. And the longer the interval in between, usually the better the response. So what NACI said is that, because health is a provincial jurisdiction, is that each province needed to look at various elements that we outlined in our recommendation to then decide when to vaccinate. And we said that given the data, we would prefer that dose is given within those 42 days.
42 days. But then Quebec is saying, well, we're going to go all the way out to 90, which is more than double your recommendation. And then the task force wrote an op-ed in the Globe and Mail with a whole laundry list of reasons not to change these double dose, mainly that the vaccines are based on the RNA technology, which has never been tried on humans before. Quote, we should not therefore lightly tamper with approved protocols, this is what they're writing, that are based on rigorous experimentation. They say that provinces should stick to what the drug companies have actually done the trials on and not sort of tamper with that. So now Canadians are kind of like, I don't know who to believe. What do you say to that?
So, all of us have some bias, right? So the vaccine task force has a bias from the pharmaceutical industry side where they say, whatever we test is whatever you guys should implement. I think and that's great when you look at it on face value. If you had all the vaccines you needed, we would go with what the manufacturer recommends. But we have to apply it in our reality where we don't have enough vaccines, where the transmission is happening right now, and where you have data that shows that in both those trials that people did get that vaccine up to 42 days. We're also basing our opinion on what other jurisdictions have been doing. So the WHO said, if you are stuck and you don't have enough vaccines, you should try and vaccinate the most people with the second dose being given at 6 weeks. And the JCVI in the UK said, based on the AstraZeneca data, which showed that the people who got their second dose 12 weeks after had a better efficacy than those who got it 4 weeks after. We're saying that we're going to do the same with all the vaccine. Granted, the AstraZeneca is not an mRNA, but one would think that, once you present an antigen, whatever way you present it, your own immune system is going to respond to that antigen, making antibodies that not disappear overnight. So I think that between there's going to be some gradient. And what you have to realize, if you vaccinate people now, when you have transmission, even if in 6 to 8 weeks you have a little bit less efficacy, hopefully by that time, the transmission will not be as huge. And so you're not going to be as exposed to the virus.
Right. The one thing I'll just say before I let you go, Dr. Quach, is that there was news that 7 residents at a Quebec long-term care home tested positive for COVID-19, but they had been among the first to receive the first dose of the Pfizer vaccine. So you just wonder if we're waiting, 45, 65, up to 90 days. Is that a risk then?
True, and it's a great question. And I think what Quebec needs to do is to gather the data to make sure that their vaccine effectiveness is monitored as we extend that interval, so that if they see that, somehow it's just plummets, then you give that second dose there. And I think for those residents in the long-term care facility, we'll still need to know when they developed their COVID, because it still takes you 2 weeks to build your immunity. So if they developed it before, possibly, the vaccine wasn't effective yet. And the other thing is, in elderly people, it's possible that the efficacy is not 90%, because as you get older, the efficacy tends to decrease. So there's also that to take into account. Not sure that having given a second dose would have changed anything at that point in time. But I don't know. I don't have the data. I think we need to look at that already.
These are ethical and health questions all colliding on an incredibly rapid speed because of the decisions to get who gets it when with this scarce supply. Dr. Quach, I really appreciate you joining us today to at least explain not only the epidemiology and the medical stuff behind it, but the ethical challenges each province is facing as they're rolling out different strategies. Thanks, Doctor. Appreciate it.
Thank you very much. Have a good day.